poised with the 5:30 report. We'll be back at 6.
Bye-bye.
Rutledge, Bob Nichols, Sports with Dan Oliver, and John Matthews, this area's most trusted meteorologist. Live from the WPEC newsroom, this is Eyewitness News at 5:30.
Open wide. Video technology is now going where it's never gone before. Good evening, everybody. Dentistry is taking on a whole new look thanks to fiber optic technology.
Yes, it is. For years, surgeons have depended on miniature cameras to probe where the human eye can't. But now, dentists are scoping into people's mouths with those same kinds of tools. Eyewitness News reporter Greg Meyer joins us from the newsroom with more on this story. Greg.
Bob, Wendy, it's bad enough having your dentist poking and pulling things inside your mouth, and now some of them want you to open wide so they can take your picture.
So what I'm going to do is you're not going to feel anything. There's no radiation involved. It's just a small television camera, and we're just going to go around the mouth.
Dr. Mitchell Josephs is explaining to his patient how his new high-tech camera will take some detailed and graphic pictures.
And what it is a miniature camcorder, basically, that's small enough to fit in the mouth.
Ann Martin is in for a routine checkup. Her teeth and gums are magnified 15 times as the dentist and patient can see inside her mouth simultaneously.
This really enhances pathology, faulty fillings in the mouth. The fiber optic light shines through the tooth and literally lights up the whole tooth. You could see fracture lines, you could see decay that's going on underneath old fillings.
The camera looks like a fat stainless steel pen. Doctors say it's easier to maneuver than a scalpel and picks up where x-rays leave off. Before this new technology was actually available for dentists, this is the view that the dentist would have of the patient's mouth. The only problem here is that the patient couldn't actually see what was going on inside and couldn't be told exactly what was wrong. Now it's in color. In fact, this video scan device, which surgeons have used in one form or another for years, probes at angles that were difficult, if not impossible, to duplicate before. It grabs images, splits them on the color monitor, takes a picture, and makes a hard copy for the dentist and the patient to discuss.
I think it's absolutely wonderful.
Why?
Because the client can see what's going on. They don't have to take the dentist's word.
Some dentists say the video scan is the best diagnostic breakthrough since the x-ray was developed, with even more applications. Now, most dentists don't have this video scan device yet. As neat as it is, the whole setup can cost between $10,000 and $15,000. Even so, we're likely to see more and more of them in the very near future. Let me just show you one quick example. This is the print, the hard copy that it makes. And as you can see, you get 4 different perspectives, and the dentist can pick out exactly what he needs to pinpoint and take a better look at. So it's actually a very neat device. Back to you.
That wasn't your mouth, was it, Greg?
That was not my mouth.
No, okay. Listen, I don't know if I'd really want this, but if I did, would it cost me extra?
Some dentists, you know, that's obviously up to the dentist because they have to pay for the equipment or lease the equipment, but the particular dentist that we had in that story does not charge extra.
You know, it dawns on me, though, that if you could see up close inside your own mouth, you might want to floss more often.
That's the theory. This is all preventive maintenance, basically, for your mouth, and that's what the dentist is trying to convince the dentist and the patients, rather, of doing, is to floss and to take care of their gums and their teeth.
Oh, reality therapy there. All right, thanks,
Okay,
Greg.
thanks, Greg. And help for the tanning impaired on Fox 29, your 10 o'clock news station.
The rest of the crewmen and
Camera can look inside. A new dentist trick to get a closer look at those pearly whites. A video scan pen-sized camera is popping up in dentist offices around the country, including here in South Florida. The tiny camera magnifies the image 15 times so dentist and patient can spot problems inside the mouth together.
The terrific diagnostic tool, number one, the things that show up on the intraoral imaging system, when I go back into the mouth clinically to compare.
The high-tech camera, originally developed for police surveillance and surgeons, will also take a bite out of your dentist's pocketbook. One of the cameras costs between $10,000 and $15,000. Kind of looks like a horror movie in there.
It's high-tech, but I bet they still ask, what do you think of that?